If you're trying to choose a yoga therapy training program, there's something important you should know. Many programs look similar on the surface, similar hours, similar descriptions, even similar promises. But the way those programs actually train students to work with real clients can be very different. And that difference can determine whether you finish your training feeling confident and capable or still unsure of how to apply yoga therapy in practice. So in this video, we want to help you understand what actually matters when evaluating yoga therapy training programs.
Hi, I'm Anna.
And I'm Brant, and we are co-directors of the Breathing Deeply Yoga Therapy School, where we've spent many years training yoga therapists to work with real clients experiencing complex health challenges.
One thing we hear from prospective students all the time is that they're trying to compare yoga therapy trainings, but it's actually hard to tell what makes one program different from another. Many programs list similar topics or similar hour requirements, but what those hours actually look like and how students develop real clinical skill can be very different. For example, how do students learn to assess a client? How do they learn to design therapeutic practices? And what kind of mentorship do they receive while working with real people? Those things can vary quite a bit from one program to another. Many of our students come from the US and Canada, though we also have students internationally.
One thing that's important to understand is that yoga therapy is a clinical skill. It's the ability to understand what's happening in a person's system and design practices that can help shift those patterns over time. People come to yoga therapy for all sorts of things, but some of them may be chronic pain, anxiety or depression, autoimmune conditions, history of trauma, experiencing symptoms of PTSD, sleep challenges, and many other complex health situations. Helping people with these kinds of challenges requires more than simply knowing yoga techniques. It requires learning how to think therapeutically, and that's one of the most important things a training program should help students develop.
When students are comparing yoga therapy trainings, we often encourage them to go back and look closely at how each program teaches students to work with real clients. In our experience, yoga therapy programs tend to fall into a few different educational models. None of these are necessarily wrong. They simply emphasize different things. Knowledge-focused programs are one possibility.
Yeah, and they focus primarily on knowledge and theory. Students learn about yoga philosophy, anatomy, Ayurvedic concepts like koshas and doshas, and the theoretical foundations of yoga therapy. And that knowledge can be really useful and valuable. But sometimes students finish these programs still feeling unsure about how to translate that knowledge into real, useful therapeutic work with clients.
Yeah. Other programs focus more on techniques or condition-specific practices. Students might learn sequences for specifically back pain or breathing practices for anxiety or practices for any particular condition. And these tools can certainly be useful. But in real life, many clients don't fit neatly into one little single category. So people often arrive with multiple overlapping challenges, which require deeper therapeutic reasoning.
Yeah, and a third approach would be really focusing on teaching students a clinical method. Instead of primarily memorizing techniques, students learn a structured process for understanding patterns in clients, designing individualized therapeutic practices, and really refining those practices through real client work. And this approach focuses on developing clinical thinking. At Breathing Deeply, this is the approach we've taken. Over time, this framework has become the foundation of how we train yoga therapists. We call it the Breathing Deeply Clinical Method, and the method focuses on 3 core competencies.
The first is holistic pattern assessment. Students learn how to understand the deeper patterns behind a client's symptoms rather than simply addressing surface issues.
The second is being skillful at therapeutic design. Students learn how to design practices that are truly individualized for the person they're working with.
And the third is guided clinical practice. Students refine these skills while working with real practicum clients and receiving mentorship from experienced therapists. So, this brings us to the practicum supervision. It's important to say that most credible yoga therapy trainings include supervised practicum hours. But something prospective students often don't realize is that the quality of supervision can vary quite a bit. The attention that's given can vary quite a bit. And what really matters is who is guiding you through those client cases.
At our school, Breathing Deeply, students are supervised by lead teachers with many years of clinical yoga therapy experience. They also work with teaching assistants who are themselves experienced practicing yoga therapists. And importantly, these mentors have worked extensively with clients using the Breathing Deeply clinical method. So when students are working with practicum clients, they're not just going and completing their hours. They're receiving guidance from practitioners who understand how to apply the method in real situations.
One thing we hear all the time from students in their practicum hours is that the supervision process is where everything comes together and really starts to work for them in real clinical settings. Students often say that working through real cases with experienced mentors helps them understand yoga therapy at a much deeper level.
And there's lots of examples of how clients might come in. But for example, a practicum client might come in with something like chronic back pain and an anxiety disorder. And using the Breathing Deeply clinical method, a student learns to look beyond just the symptom and understand the deeper patterns contributing to that person's experience. Then they're able to design practices specifically for that individual and refine them over time as the client gives feedback and responds. Over the years, students in our programs have worked with thousands of practicum clients across many different conditions. Across these cases, we've observed an 86% positive outcome rate, meaning the client experienced meaningful improvement in the issue they were seeking help with. Importantly, these outcomes come from real-world client work conducted during supervised practicum using the BDYT clinical method. Of course, yoga therapy isn't a medical cure and outcomes vary, but what this does suggest is that when yoga therapy is applied through a structured clinical framework, it can make a meaningful difference for many people.
So we have a flexible pathway. Often when prospective students are looking at different programs, they're wondering about the different pathway that we offer and the pathways that are available, especially towards certification. Some people already know specifically when they're coming in that they want to receive the CIAYT certification, but others aren't really sure. They haven't started their training yet. They don't know what they think about yoga therapy training, and they come in as yoga teachers or wellness professionals who want to become more effective at helping their clients and their students through yoga. All of our students, however, begin with our Yoga Therapy Foundations program, where they learn the core therapeutic skills and clinical thinking that form the basis of our method. Students find that the Foundations training certification alone significantly deepens their ability to help the people they already work with and their students. They also have the opportunity then to continue on with our modular advanced program, offering certification at the highest level.
If you're watching this video, there's a good chance you're already thinking seriously about developing therapeutic skills through yoga. Some people watching are yoga teachers who want to work more effectively with students who have health challenges. Others are wellness professionals who want a deeper therapeutic framework. And some feel called to pursue yoga therapy as a professional path.
Wherever you are on that spectrum, and even if you don't know exactly at this moment, the most important thing is finding a training that helps you develop real skills and confidence working with individuals.
So if you're seriously considering yoga therapy training, the best next step is a free training we've created that explains how yoga therapy certification works, how students move through our foundations and advanced programs, and what it takes to develop real therapeutic skill. And you can find a link to that right below this video.
So, this free course or walkthrough will give you a much clearer sense of whether this path feels right for you.
Thank you so much for watching. We hope to meet you soon.